everyone, I'm Claudine Jola Madrid, and today I will be performing perineal care return demonstration. First up, what is perineal care? Perineal care is also known as peri-care. It involves the cleaning of the private areas of a patient because this area is actually prone to infection, so it must be cleaned at least daily. On the other hand, postpartum perineal care is cleaning and caring for your perineum after having a baby. Also, before performing the main procedure, assess for the presence of excessive bleeding, odor, pain, discomfort, presence of indwelling catheter, and recent episiotomy and episiotomy. Before we proceed, of course, we have to make sure that we perform hand washing technique to protect the patient and myself from cross-contamination. Next, we have to ensure that we provide for client privacy by drawing curtains around the bed, closing the door to the room. Okay, now, so we can prepare the patient. So these are the materials for the procedure. We have gloves, we have warm water, irrigating solution. You can also use warm water. Don't forget the soap, clean towels, and the bed cap. So first, introduce yourself and verify the client's identity as per the agency protocol. Explain to the client what you are going to do, the purpose, and how she can be able to participate. Hi ma'am, good morning. I'm Claudine, your student nurse for today. How are you? Good. May I please see your pen and state your name? First name Winnie and last name the Pooh, Winnie the Pooh. Please state your birthday. Okay, thank you. Now, today we will do a perineal care. This procedure will not only clean the area, but also, of course, to check for infections or lesions in the area, okay? So also, it will help us ensure that we clean any vaginal discharge because this discharge will actually cause, infection in the area. Okay? Ma'am, I will be exposing your perineal area, okay? And I will put waterproof pads, these ones, just underneath you so that the bed will not be soiled. And of course, for you not to get soaked with water or any fluids. Alright? Then after, we will put everything back to normal. Okay? So now, position the mother in a backline position like this, with knee flexed and spread well apart. Okay ma'am, so let's go ahead and position you. Please flex your knee for me and turn to the side, or can you do it on your own, or let me help you instead, okay? So now I will be putting the waterproof pads for me. Thank you. And on the other side. Thank you. Again, make sure you did your hand washing technique, okay? Use clean gloves. And in this case, what I will do is that I will use a clean towel. I will use a mid-folded method in this case. But first, you have to wash your clean towel. Then use the mid-fold method. Or you can also use, another option is a washcloth with a triangle fold. But in this case, again, I will use the mid-fold method. And now I will be putting soap. Okay, now so I have 3 areas of the washcloth. We have 2 sides, 1 and 2, and in the middle part. Now I will separate the labia using the 2 sides. Notice my direction is going down, front to back. On the other side, front to back, and then down in the middle as well, front to back. This is very important because it lessens the chances of infection. And now this towel will now go into the linen. Okay, now see, so on this case we made a new one. Again, we used a mid folded method. Then do it again. Separate the labia, go down from the side, front to back, and on the other side, front to back, and in the middle, of course. Now let's go ahead and dry the area using a clean cloth. Okay, now ma'am, so what I'll do is I will put the bedpan underneath. Please turn to your side. And then I'll go ahead and separate your labia and wash the area. This might hurt a bit or uncomfortable, but no worries, I'll do this very quickly, okay? Okay, now, so you may place the client on a bedpan and use a peri wash or an irrigating solution. Or you can also use warm water to pour over the area. Then dry the perineum thoroughly, paying particular attention to folds between the labia. Of course, make sure you dry the area after pouring the water. Tap only on the other side and in the middle. Okay, ma'am, so let's now turn you on the other side. Okay, now, so I'll get a new washcloth and put some soap, of course. I will wash her from front to back, starting from the middle, then on the sides, left and right. Then again, I will use another washcloth. And then put some soap. Then wash from front to back, start in the middle, then side to side. Then use a dry cloth. Pat her dry with the same direction. Okay, ma'am, so let's turn you back now to normal position. Okay, now we're done, ma'am, and I'd like to thank you for your kind cooperation. Okay, now remove and discard the gloves. Make sure not to contaminate your hands like these. Put this in the proper disposal, and also perform hand hygiene and documentation for your findings. For postpartum women, document the amount, the color, and odor of vaginal bleeding by subtracting the weight of a used or new perineal pad to that of the used perineal pad. 1 gram weight is equal to 1 ml blood loss. And now we're done. Once again, I'm Claudine Jolie.